We've talked about healthcare workforce, healthcare recruitment as a Department of Health for decades. And it has been coined as a rural health issue. Now we're looking as a state and a nation as a nationwide issue. And with that, although as challenging as it is, that's why events like this are perfect timing. Because more than ever, we have the attention of both our local and our national leaders, our policymakers, federal funding groups that are helping put resources into states to help them address the issue.
What I wanted to highlight here now is those nurses that are actively employed in South Dakota. So this is an estimate of our active population. So then we bring this down to about 14,853. So roughly 76% of our RNs are actively employed in South Dakota.
And we've been knowing for 25 years that baby boomers are going to leave the workforce. And the time is now. The youngest baby boomer is 60 years old today. So it's no wonder that a majority of them have left the workforce, and then we're going to have that last little wave. And our population is not replacing the numbers that are leaving the workforce. So other things that reinforce what you know to be true is we have the lowest unemployment rate right now that we've had in a very long time. Our current unemployment rate is 2.3%. 3% unemployment is considered full employment. Anytime you get to 3 or lower, then you start to have friction and employers have a hard time finding workers, and we're well below that.
Connect with your local school district. If you're not already, they want to connect with you. You should want to connect with them to help build your pipeline. Best time to plant a tree, 20 years ago. Second best time today. Connect with your middle school, connect with your elementary school now so that you've got that workforce when you need them. Sponsor education programs, offer those work-based learning opportunities, and then Build Dakota. If you haven't heard of Build Dakota, pay attention when my colleagues talk. It's a fantastic program you definitely want to know more about.
We have a problem to solve, right? And so it's already been demonstrated for you very well. Our healthcare needs are growing across the state. The Board of Regents and the Board of Tech Ed are committed to working together and for training purposes and the development of a nursing workforce.
In order for us to meet the pipeline, you heard Dr. Maurer talk about the ability to increase our capacity. In order really to be successful on both fronts, we need to increase that pipeline and we need to retain those completers in South Dakota. So it really is not only educating, but once they complete, trying to mitigate that out-migration of that student, so trying to retain those students. As we look at the pipeline and we increase access through affordability, Build Dakota Scholarship, and I want to give a big thank you to Avera Health, Monument Health, Sanford Health, and all of the industry partners. Those are all listed on their website, at the Board of Technical Education website, through that Build Dakota Scholarship program. Specifically, Nick wanted me to share that there are 170 awards in the healthcare related fields for cohort 21 and 22. That's impressive. That means we're helping 170 students go to college, giving them accessibility.
To be successful, to increase the pipeline of nursing students will require a lot of stuff that all of us have to do. We have to be partners in that challenge. Colleges and universities will continue to work toward increased partnerships and enrollment strategies. That's who we are, that's what we do. That won't change. The question we have to get to and have to be able to answer is, how could we provide BSN opportunities to those already employed? Or how can we provide an increase in opportunities to gain credentials? What can we do to accommodate those who are current employees in improving their credential status? What, if anything, can we do to mitigate the out-migration of graduates? We want to make sure that we're a part of that conversation. We're one of many who have to be at the table for that conversation, but we want to be a part of that conversation. Also, we're going to need to work with our clinical partners to ensure that cohort size can increase to meet the clinical needs of the program for field experiences and for program licensure requirements. There's a lot to do, and it's going to take people like you, meetings like this, and a bunch of well-intentioned folks who want to see what's best for not only our local cities, but our state and our nation. It's a complicated problem, and it's one that's well worth our attention.